One day, you saw one of your friends just frequently washes their hands, which is a good thing since we're dealing with COVID-19 and washing hands help to overcome this problem. But they washed their hands till it was visibly red. So you tried asking them about their habit, and they said that they have OCD. Your reaction was like, "What is that? Never heard of it." So, in this video, we're going to talk about what exactly is OCD.
Obsessive Compulsive Disorder, or OCD, is one of the mental health conditions that are often misunderstood by the society and even health professionals. People with OCD usually suffer from having repeated thoughts, intrusive images, or impulses that often drive their life miserable. OCD was formerly classified as an anxiety disorder, as the affected people often experience severe anxiety. Before we go further into OCD, we need to know exactly what is anxiety disorder in order to understand what these people go through. Anxiety is a common emotion when dealing with daily stresses and problems, but it keeps on coming back and someone interferes with one's ability to function and do daily activities. It is considered as a disorder. People with OCD have no control on what they are doing and thinking. This is what makes OCD a mental illness, because their action will interfere with their daily activities to the point where it could cause a significant distress. Some people might have mistaken themselves on having OCD, but in fact, they are just hygiene-obsessed a little more than usual. People with OCD acknowledge that their thoughts and habits do not make any sense, but if they stop, they would be unable to concentrate in school or work because of the addiction their anxiety caused. OCD can be divided into two types, which is obsession and compulsion. So what is the difference between these two? Obsession is the intrusive thoughts, impulsions, or impulses, while compulsion is the action one will do in order to relieve the anxiety that obsession caused. Now we move on to a more serious question. How does someone develop OCD? There are several factors of what can cause and trigger OCD in one's life. One of them is having a family member that was diagnosed with this disorder. Research has shown that if you, a parent, or a sibling have OCD, there is a 25% chance that another immediate family member will also have it. Secondly, certain parts of the brain have different biological factors. People whose brain have OCD may have difficulty deciding which thoughts and impulses to turn off, which causes obsession or compulsion to trigger. This is caused by serotonin abnormalities. Next, it could come from other mental illnesses such as depression, anxiety, or tics. Some patients might experience OCD in order to cope with post-traumatic stress disorder or PTSD. Lastly, someone with OCD might have a history of physical or sexual abuse as a child.
Now, let's move on to the signs and symptoms.
There are several signs and symptoms that can help you recognize if you have OCD. Firstly, you can be obsessed with order and symmetry, like the idea that everything must line up just right. Secondly, you are overly excessive in double-checking things, such as locks, appliances, and switches. Next, you may have an irrational fear of being contaminated by germs or dirt, or the fear of losing or not having things you might need. There is also the restless counting, tapping, repeating certain words, or doing other senseless things to reduce anxiety that people without the disorder wouldn't usually do. If you are diagnosed with OCD or simply have the nagging feeling that you do have OCD, there are actually a lot of ways that can help prevent you from further developing the disorder. First, you can learn about OCD. Learning about your condition can empower you and motivate you to stick to your treatment plan. Next, stick with your regular activities. Go to work or school as you usually would. Spend a lot of meaningful time with family and friends. There is no reason to let OCD get in the way of your life. You can also join a support group because reaching out to others facing similar challenges can provide you with support and help you cope with challenges. If self-treatment doesn't help, you can always go to a session of psychotherapy. Cognitive behavioral therapy, or CBT, is effective for many people with OCD. Of course, there are other various methods of overcoming OCD. For instance, staying focused on your goals, finding healthy outlets, and managing your stress and relaxation.